Hey, this is the second in our series on dental health. Part two is about what really causes multiple sclerosis and treatment pearls. We tend to think of neurology and dentistry as completely separate worlds, but Dr. Peter Rogers has spent years connecting the dots between what's happening in your mouth and what's happening in your brain. In the second part of our series on dental health, he explains why some chronic diseases, including multiple sclerosis, may actually have origins in dental exposures that most doctors overlook. Peter is uniquely qualified to break this down because he doesn't stop at nutrition. He studies the full terrain of human health, from biochemistry to environment to how our medical system often ignores root causes. This talk dives into new science and practical insights you won't hear in conventional medicine, and it could literally change how MS and similar diseases are treated. Peter, are you ready to get started?
Yeah, this is my first slide here, and this is Dr. Hal Huggins, and this is his book, Solving the Multiple Sclerosis Mystery. Plus, I'd also say something. I actually think people who have got an IQ over 145, they probably shouldn't go into medicine or into dentistry or any of these fields, because the smarter the person is, the more likely they recognize all the obvious BS. You know, you get an IQ like around 130, they're able to learn everything, but they're not able to question things. And they'll function perfectly well, make a lot of money, and be happy. But you start getting up 150 and higher, they're like, hey, this is BS. Hey, this is BS. Hey, this is BS. And then the system says, shut up, shut up. But they go, but this is BS too. This is BS too. They're like, shut up, shut up. Okay, that's what it's like. And I'm not kidding. That's exactly what it's like. So anyways, this guy was a genius, Hal Huggins, and he noticed that he took out amalgams and some of his patients were getting better. Other patients who got amalgams, they would develop MS, in a temporal correlation to that, not that long afterwards. And he was amazed that patients were getting better. He also, he took a year off from his dental practice to go back and get a degree in how the immune system works and immunology, because he kept noticing things that made him want to understand immunology better, that these dental metals were causing disease, both diseases related to the mercury, diseases related to the amalgams, diseases related to root canal procedures. Anyways, this is sort of the crowning book of his career. It came out in about 2002, Solving the Multiple Sclerosis Mystery. Okay, and that's him in his older years, Hal Huggins. Okay, he's him and Weston Price are the two greatest dentists who ever lived. They're quite amazing. Here's an amalgam filling. You can see it filling up the enamel here. He describes the amalgams as being like a Trojan horse. They call them a silver filling, but it's really a way to get mercury into your body. And then the mercury leaks out through vapor, and you inhale it through your nose. That can go to your brain. You swallow it through your mouth. The bacteria in your mouth can convert it to methyl mercury. That's more absorbed, and that can go all over your body, including it can travel through your blood to your brain. Here's another painting of a Trojan horse. Beware of Greeks bearing gifts. Beware of dentists putting metal in your mouth. Hal Huggins describes the mercury as being like a Superman, in the sense that it comes into the telephone booth as Clark Kent and it comes out more potent. And what he's getting at is the elemental mercury, that's what's in the amalgams, has no valence on it, no charge on it. But the bacteria in the mouth, it's poison to them too. So one of the ways they can neutralize it as a poison is if they stick a methyl group on it, which is a CH3, carbon and 3 hydrogens group, onto it. They can then pump it out of their bodies, and it still, though, remains very toxic to us. Again, we can absorb that across our intestinal lining, and then it gets into our blood and can cause us all sorts of problems. Okay. And then because the methyl mercury is also not charged, it can cross the plasma membrane barrier of a cell. Once it gets into the cytoplasm, it's converted to Hg2+. So now it has a charge on it. It's a 2+ positive. That means cation. The cation is attracted to the negative charge inside of the mitochondria, which you have a big intermitochondrial membrane gradient, like negative 160 to negative 180 millivolts, and it'll go into the mitochondria and it'll injure the mitochondria. I'll talk about that more, how it does that. The big thing is it mimics iron. Iron also will typically have a Fe2+ charge on it very often, and that'll be bound to sulfur. So mercury has a stronger affinity for sulfur. So it goes into the intermitochondrial membrane, into the iron sulfur clusters, and it knocks the iron off, and then it latches onto the mercury and it just damages the mitochondria rather severely, because now you don't have good electron transport. The iron drops into the matrix of the mitochondria and can initiate the Fenton reaction. I'll show pictures of all that stuff. Hal Huggins describes mercury, and you got to remember, this is a brilliant guy who studied mercury for decades. He says trying to deal with mercury is like herding cats. It gets inside of a cell, doesn't come out of the cell. It scatters very rapidly from its site of origin, that it's very difficult to track it down. There's only one chelator that works, and it's called MBMI. It's like a super glutathione, and there's a kind of a sad story. It's almost funny. It's so sad. There's a guy by the name of Boyd Haley. He's this Irish-American biochemist, and he brilliantly figured out how to get MBMI as a chelator to work. The other chelators don't work well for mercury, things like EDTA, DMSA, and all that. And you needed something that could go inside the cell, grab the mercury, take it out of the cell, and get it out of the body. And MBMI does that. So they first sold it as a supplement, but they made the mistake of claiming that it works. Once they claimed that it works, then they go, well, this isn't a supplement anymore. This is a drug. And then in order to get a drug approved, you have to get funding and do the appropriate clinical trials, but no corporation wants to fund it. So basically, they've got something that works. They've proven it works in animal studies quite extensively. Logically, you'd expect it to work in humans. And it had been given a lot to humans in supplement form and done well. But now it's what you call an orphan drug. No corporation will take it. Millions and millions of people could potentially benefit. It's actually one of those few drugs that sounds legit and useful, but it can't get funded. So all these people have tons of problems. And the one thing that could help them in terms of a chelator, it's not allowed. Okay, now here is multiple sclerosis. The incidence has been going up and up and up, especially since about 1974, 1976. The 1976 day is quite relevant because that's when they introduced the markers, the high copper amalgams, which cause more rapid leakage of mercury vapor. The dentists like them because their metallic properties are favorable for dentistry, but they're not favorable for the patient's health. And so the incidence of MS has been going up and up. And the diet's also been getting worse. And some people say that the MRI criteria are making it easier to diagnose. So it's probably all three, but the incidence is still increasing. Dr. Huggins, on his business card, he has Dragon Slayer, that he is the one who slays the dragon. Okay, so what is he talking about? What he's saying is he had a lot of patients come in with autoimmune disease like multiple sclerosis, and he would take out their amalgams, and a lot of them got better. So he claimed that he was like St. George the Dragon Slayer, saving the damsel in distress. Because, 80% of autoimmune diseases are women. So the typical MS patient is a middle-aged female. Okay, so that's his business card. And then he says some of the Asian patients in countries where they sort of almost like the dragon is a very positive symbol to them. They're like, why you do this? Why you want to hurt a dragon? Why would you do that? Okay, so anyways, this guy right here is Charcot. And he's a very famous neurologist from France. Okay, and he's real stuck up too, and he's real funny. He first described the first case of multiple sclerosis in the neurology journals back in 1868. This painting is of him at the hospital, famous hospital in Paris called Salpêtrière. So this is Charcot at the Salpêtrière. And he described a lot of neurologic diseases, and he later kind of got into some funny business with the hypnotists and with the hysteria patients. Like this lady, I think her name is Blanche Whitmer or something, and she would have hysteria fits, and so all the students are looking at her. Freud went and studied with Charcot, okay, in France, neurology. So that's another famous story of Charcot. Anyways, the key point is they started putting amalgams in around 1818, these mercury amalgams, like kind of the modern version of it, so to speak. And they became pretty widespread by 1830, and then pretty soon after that, multiple sclerosis was described. It didn't exist before then. That's another temporal correlation between mercury amalgams and multiple sclerosis. And you're going to see there's going to be multiple things that all add up to suggest that mercury amalgams are contributing to causing multiple sclerosis. There's something called consilience. Consilience is a very valuable vocabulary word. You want to know this one. What consilience means is that you see one line of evidence, and it suggests, for example, here, mercury causes multiple sclerosis. You go, okay, that's one line, but there's a lot of other evidence in other directions. I'm not sure I believe that. Then you see two. You go, oh, maybe, okay, both of them make me about 5% more certain that MS probably does. Okay, so now I only got 10% certainty that MS does. Then you see 3, 4, 5, 6, 7. You're like, now I got 7 different things indicating that mercury from amalgams appears to cause multiple sclerosis. So now you think, wow, that might really be real. So that's what consilience means. A whole bunch of low-level evidences by themselves, but when you add them all together in aggregate, they're pretty strong. And that is the truth of what's going on with mercury amalgams and multiple sclerosis. Here's a cross-sectional view of the brain, a axial image, you would call this. Like if you slice the human body like a loaf of bread from top to bottom, this would be the level of the cerebral ventricles, the lateral ventricles here. So the blue stuff is the CSF, cerebral spinal fluid. The gray matter ribbon is this brown thing on here. That's the cortical ribbon. These perpendicular blue lines are the periventricular veins, okay? It's important that you see that they're perpendicular to the lateral ventricle, all right? Because MS occurs right along these veins, okay? This is a normal brain right here. At the level of the ventricles called the periventricular deep white matter, okay? It's also called the corona radiata because it looks like a crown that radiates around the ventricles, okay? Now, here's multiple sclerosis. You'll typically get lesions right around the side of the vein, and they're perpendicular to the lateral ventricles. One of the first scientists to describe it was Dawson, and they're called Dawson's finger is the characteristic appearance of these lesions on a brain MRI. Okay. And they did cerebral spinal fluid taps on these patients, and they found the patients with multiple sclerosis tended to have 8 times as much mercury in their cerebral spinal fluid. So that's another chemical mechanistic correlations to indicate it seems to be the case. In 1998, Hal Huggins and another doctor named Thomas Levy, they wrote a landmark paper where they're doing lumbar punctures. That's a spinal tap. You put a needle down in the lumbar canal into the CSF, cerebral spinal fluid, that surrounds the brain like a water helmet, goes in continuity around the spinal canal, protecting the spinal cord. Okay, and they found that they had these abnormal proteins in the blood of the multiple sclerosis patients, and they were seemed associated with the amalgam patients, okay? And when they took out the amalgams, the abnormal proteins would go away. So what they thought it was damaging the brain, and little pieces of brain were getting sloughed into the cerebral spinal fluid, okay? Kind of a scary thought there. There's tons of references if you want them in that book. If you got multiple sclerosis, I highly recommend that book, Solving the Multiple Sclerosis Mystery by Hal Huggins. Okay. You look at the MS incidence, it's a lot more common in cold countries. It's a lot more common in westernized countries. In Norway, up north in Europe, Roy Swank noted that it wasn't the further north you go that the incidence will go up. It was the central area of Norway had a lot more multiple sclerosis than did the coastal areas. And he felt that was probably because in the central area, they were drinking more dairy. He felt dairy was the biggest risk factor with all the saturated fat in general. But still, this is an important pattern. Colder areas, more westernized areas, they get more MS. So the dark orange is more MS. And there's more MS in Canada, for example, which is colder than there is in USA. Okay, now here was an incredible book. This was published in 1985, and it's written by a Swedish doctor, Patrick Stortebecker, MD, PhD guy. And I read this book, and it was so amazing, this book. And I tell you, that's, the guys who write the best books are old guys. A young guy is trying to make some money. He's trying to attract a woman or support his wife and his young kids. He really can't afford to piss people off, okay? He's trying to make partner in his medical group. He's trying to get approved for tenure at the university. So he kind of has to kiss butt to the system. But an old guy really doesn't care. An old guy, quite often, who's done a lot of good work, he's a little pissed off. He's been ignored for 20, 30, 40 years. He knows his research is good. The journals are screwing him over. The establishment is screwing him over. He says, screw it, I'm going to write a book. And so they write the book, and they explain everything in their field in this great logical, coherent sequence. And that's what this book is. It's a masterpiece. Mercury Poisoning from Dental Amalgam, A Hazard to the Human Brain. Patrick Stortebecker. I couldn't believe how good this book was. He just went through study after study. And you can tell when you're dealing with a smart person, logic. And this, because of this, because of this, because of this. Somebody who really knows what they're talking about. They talk about causation. This causes this. This is why we believe this causes this. That's how the good books are. The BS books are always like, drug protocol number 1, drug protocol number 2. Like I just recently watched a whole bunch of neurology lectures from my continuing medical education. And they would just go, here's how we diagnose the disease, and now here's how we treat it. And I'm like, excuse me, what about causation? What about pathophysiology? That's the most important thing. You have to have an understanding of what causes the disease to know how to cure it. To avoid the thing that causes it is usually how you cure a disease, if it's curable. Anyway, so what are some observations that Stordebrecker made? He knew back in the 1960s, the veins in the face are in continuity with the veins in the brain. They do not have valves, and that's so you can drain your head no matter what position you're in. If you're standing, if you're laying on your stomach, if you're laying on your back, if you're laying on the side or this side. So you can drain your brain pretty effectively no matter what position your head is in, because these veins don't have any valves and they go to your face. Okay, but the significance is they also go backwards up to your brain. So they go into the tooth apex, and stuff from the tooth apex can go backwards up into your brain. So that's venous transport. Remember how we talked about that MS brain axial image? The MS plaques, Dawson's fingers, occur right along the periventricular veins. So you can totally get from the tooth straight by retrograde venous transport up into the brain. And if you can cross the blood-brain barrier, well, guess what? Elemental mercury has no valence. You know, Hg0, no charge on it. That can cross the blood-brain barrier. Mercury, methyl mercury, that has no charge on it. That can cross the blood-brain barrier. So now you've got a transport mechanism, and you've got an ability, a plausible mechanism to get across the blood-brain barrier. A dentist by the name of Ingalls noticed that there was more MS. If the patients only had amalgam on one side, there would be more MS on the side where they had the amalgams. Okay, so then you have a spatial correlation to the MS. Okay, you have a plausible transmission mechanism, you got plausible toxicity, you got plausible mechanisms of transport into the brain, traversal of blood-brain barrier. And here's another one. Along the nerves, you can get retrograde axonal transport. So the long part of the nerve is called the axon. And they found that heavy metals, including mercury, could transport backwards, retrograde along the nerve into the brain. So that's another mechanism to get mercury into the brain. Okay. If you inhale the mercury, let's say you're inhaling elemental mercury, that can go through the olfactory nerve up here in the nose, and that can then travel into the brain in that way. So it can get in, it definitely gets into the brain, and they've seen it at autopsy too. Okay, a little bit about mercury. Let's see, we talked about plausible transmission routes, nasal inhalation, venous retrograde transport, neuronal retrograde transport, the spatial correlation of Dr. Ingalls, the side with more mercury, more lesions that side. This is what I meant by consilience. Things start adding up. Temporal correlations. Historically, MS started showing up after amalgams started being placed. Amalgams widespread in 1830. First case of MS ever described, 1868, Charcot at the Salpêtrière. Okay, a lot of patients, they would get MS not that long after having mercury amalgams placed in their mouth. Another temporal correlation. A lot of patients got better after the amalgams were removed. Another temporal correlation. An increasing incidence of multiple sclerosis after the high copper amalgams were introduced in 1976, which caused more rapid leakage of mercury from the amalgam. Okay, so that's interesting. Now, the other thing about it is MS is multifactorial. And the reason I'm going through all this is, by the way, I think Roy Swank, MD, PhD from Harvard, friend of Dr. McDougall, I think he's right about the majority of MS being related to leaky gut due to high-fat diets. I think that's the majority of them. But I think you can also cause MS in these other ways. And other things that go with that, patients who've had a lot of traumatic brain injury, they have higher incidence of multiple sclerosis. Patients who have excessive toxic exposure to aluminum, which is in your drinking water and forms complexes with fluoride. We just talked about that in tap water, goes into your brain. They have increased incidence of aluminum in the brains of MS patients. And there's been some papers written that patients who have high exposures to lead have increased incidence of multiple sclerosis. That's also an indirect correlate for consilience that mercury could do it, meaning that aluminum is a heavy metal, lead's another heavy metal, and so is mercury, and they could contribute to causing neurodegeneration, brain damage, okay? And every one of them is a mitochondrial inhibitor. And then you can start thinking, well, gee, if mercury is a mitochondrial inhibitor and lead is a mitochondrial inhibitor, and so is then also traumatic brain injury injures the mitochondria, well, maybe any mitochondrial inhibitor can contribute to MS. You see how the logic jumps? And then like, holy crap, I just gave a lecture on VegSource a couple months ago about mitochondrial inhibitors. I found over 100 of them. There's 0 of them in the medical school biochemistry books. There's 0 in the college biochemistry books. But I knew there had to be a bunch because SAT-FAT in particular inhibits intermitochondrial membrane electron transport. And I knew I had vaguely come across them in papers I read. So I started searching for them. So you can see where I'm going. If I had MS, I'd get those amalgams out and I would avoid all those mitochondrial inhibitors. And I would filter my water, minimize aluminum exposure, minimize fluoride exposure. Okay, let's see. Now, this is Boyd Haley. He's a hot-headed Irish biochemist guy. He's kind of funny watching him talk about Mercury and MS. He gets kind of annoyed. He's all pissed off because they wouldn't accept his drug. He did this Nobel Prize level work to show how great NBMI chelator is, and they screwed him, and they won't fund his drug, so it's off the market. So like we talked about, no valence on the elemental mercury, what's in the amalgams themselves. Mercury vapor has no charge on it, can cross the blood-brain barrier, can be inhaled into your nose. That's why it's better to be a mouth breather if you got amalgams. It's even more vaporized at hot temperatures. So when you drink a hot thing like hot coffee, hot tea, or hot anything, it'll cause more mercury vapor coming off your teeth. Okay, and by the way, not to just scare you, but like, what do you do if you got amalgam? I have some amalgams. You just try to excrete more every day than you take in. Okay, you never get all of it out of your body, but if you try to excrete more than you take in, and you can't measure it that easily, you can't measure it at all, really, but you can sweat it out. So I try to exercise and sweat every day, for example. And like I said, I don't ever brush over the molar surfaces, the occlusal surfaces. I don't ever grind my teeth. Like I'm lifting weights, I'll consciously make sure I'm not grinding my teeth. I don't hold a cell phone to the side of my cheek like that unless I absolutely have to, which essentially never happens in my life. My life's kind of boring, very low tech. You'd be surprised. Let's see what else. I don't chew any hard foods, you know. Okay, organic mercury is when there's a carbon attached to it. So that's like methyl mercury made by bacterial conversion from the mouth bacteria. Thimerosal is used like in contact lens solutions and some other things as a preservative. That also is organic mercury. It can also cross the blood-brain barrier. I went to the eye doctor when I was in my 30s, and he told me, he said, "Pete, you got little cataracts." I'm like, "What are you talking about?" He goes, "Yeah, you got little cataracts." And, you know, I was an imaging guided surgeon working with a lot of fluoroscopy. That's, you know, the fluoroscopic X-ray beam while I was doing procedures. And I'm trying to be pretty careful about radiation protection, but that kind of scared me. And I went, that was right around the time I was becoming a vegetarian. I wasn't a full vegan initially, but I was pretty careful about my health habits. And just for what it's worth, since my early 30s, I'm now 62, I've had no change in my vision. I wear the same glasses as I used to. So I think I stopped the cataract from progressing, you know, and I reduced my milk intake. Milk can make it worse. It's thought that the lactose, you know, gets metabolized, glucose and galactose, and then the body can't necessarily handle that galactose, even if it can split the lactose in your gut. Okay, body burden of mercury at autopsy is roughly proportional to the number of amalgams in most people. Some people are better at excreting it than others, so they're lucky. Some people are real sensitive to it. They have problems more quickly after mercury amalgams are placed. Many people tolerate them pretty well for a long time, obviously. Oh, that guy, Patrick Storterbrecker, he says, if people always say to me, well, if amalgams are so bad, how come most people have them, tons of people have them, and not that many people are symptomatic? He says, not that many people have dramatic symptoms like multiple sclerosis, he says, but lots of people have what he would call micromercurialism. It can sometimes make it difficult for a person to sleep. They have more frequent awakenings. It can sometimes cause impulsivity in their personality, more irritability, unexplained angry outbursts, anxiety, depression, gradual cognitive decline, worse than expected. I see tons of cognitive decline. Like I said, in my clinical experience, most patients over 60 are mentally slow. And I can tell you, my internal medicine doctor buddies, I've had several of them tell me, for almost every single patient they have over 60 years of age is cognitively slow. Okay. All right. I told you what happens in the mitochondria. The mercury knocks the iron off of the iron sulfur clusters in complex 4 of electron transport, and that shuts down electron transport. I'll show you a picture of that. It'll be easier to grasp when you see a picture. Let's see. Okay. Oh, yeah, by the way, well, I'm not going to get into all the establishment stuff, but the establishment stuff just kind of wants it to quietly go away, and it quietly is going away. All right, here's electron transport chain, inner mitochondrial membrane. This is where most of the energy in your body, about 90% of it or more, is made. ATP, adenosine triphosphate. You know, the protons are pumped into the intermembranous space. The gradient is harvested at the end. Complex 5, ATP synthase. It spins, and then a phosphate's added to ADP, adenosine diphosphate. Okay, so these are all things that inhibit inner mitochondrial membrane electron transport. Fluoride does. Mercury does. Glyphosate, the stuff sprayed on non-organic foodstuffs, including soy. Cadmium, on a common food contaminant in processed food. Atrazine, the herbicide that is sprayed onto corn, for example, that's in high fructose corn syrup. So the average person is exposed to all these. Like I said, these toothpastes tend to be real high in lead. So you can very easily see this would be a routine thing for an American to be exposed to. Just right here, 1, 2, 3, 4, 5, 6, 7, 8, 9. Hydroxynonenal is a toxic from omega-6 oils, cooking oils exposure. So they can easily be exposed to these 9. And as a matter of fact, lots more. I think it's routine for people to be exposed to 15 or 20 or more of them. So this could really drop your energy level. All right, now here's a position paper by the IAOMT, the International Academy of Oral and Medical Toxicology. And they're a very impressive organization. Like I said, they were co-founded by Murray Vimy, who's a world expert on mercury toxicity, amalgam toxicity, and other guys like Hal Huggins are in this group. And the best of the best dentists will be in this group. Boyd Haley's in this group, for example. He's not a dentist, he's a biochemist, but he lectures over there. So they summarize the research papers, all showing kind of what I would describe Consilience. And Hal Huggins removed over 1,000 amalgams for patients with MS, and he says lots of them got better. And he's the one who did that paper on the cerebrospinal fluid, showing that that the abnormal proteins went away once they had the amalgams removed. Okay. And then in the autopsy studies, they found more amalgams in the brain. Here's the paper if you want to see it. Cerebrospinal fluid protein changes in multiple sclerosis after dental amalgam removal. And there's Hal Huggins and there's Dr. Levy. Okay, here's one. I'll give you some good news. All this stuff, let me give you some good news. When you sweat, the sweat glands in your armpits, everywhere else, they're like little kidneys, and they excrete heavy metals. So you will sweat out mercury, you'll sweat out lead, you sweat out cadmium, you sweat out arsenic. So that's wonderful news. So you want to sweat every day. The other thing is, I always knew that I liked being warm, and I figured it makes my immune system work better because the white blood cells run around the body faster doing their job, checking for problems. And I just knew I could think better because I often have to do really challenging intellectual things like spend 12 hours a day writing a book chapter, okay? So I just knew, because I'd experimented a lot, what makes me function optimal from an intellectual point of view. As soon as you wake up in the morning, sit down at your desk and start working on the book chapter, okay? Do not bullshit around. Do not work out. Do not eat breakfast. Do not take a shower. Sit down and start to work, okay? And then I also noticed, be real warm. So I just know that works. I don't know if it speeds up my brain or what. And the reason I'm mentioning that, all this stuff is coming out. That guy over at MedCram, a real smart guy, Dr. Roger Seheult, Seheult, S-E-H-E-U-L-T. MedCram's his website and his YouTube channel. He's doing tons and tons of work trying to figure out the effect of sunlight, infrared, red light on improving mitochondrial function. And I just wonder if being warm improves mitochondrial function. I think it does. I think, you get a fever to make your immune system function better. And I'm not talking about being super hot. I'm just talking about being nice and warm, cozy, a little sweat. I know it helps me, and I sweat a little bit when I do that. I know that I'm at my best when I do that. I've been doing that for decades. Okay, so we know about abdominal pressure syndrome. You need to eat dietary fiber, adds water to the stool, bulk to the stool, makes your bowel movement effortless so you don't get abdominal pressure syndrome from a backup of pressure. The person who doesn't eat fiber, they get dry stool in their rectum, and then they have to strain at defecation called Valsalva maneuver, and then all these problems related to pressure happen. That's Dennis Burkitt's abdominal pressure syndrome. It's good stuff. I talk to doctors from other countries where they eat high fiber diets, and they go, Peter, we do not have diverticulosis in my country. I'm like, yeah, they eat high fiber diets. Okay. Whereas in USA, I see diverticulosis on the vast majority of the patients over 50, over 40 even. Okay. Here is leaky gut. So here's normal gut. Normal gut, you've got tight junctions between the lining cells of the intestine. Lining cells are called enterocytes because the gut's called the enteric tract. So entero means gut, site means cell. In between the cells, there's a single layer thick. They form tight junctions. The tight junctions prevent bad stuff from getting across the gut lining. The way it works under normal conditions, when you eat the dietary fiber, that is food for your good bacteria. The good bacteria are right here drawn with a smiley face. They convert the fiber into short-chain fatty acids, most importantly into 4-carbon butyrate. 4-carbon butyrate, it's like a butanoic acid, okay, a 4-carbon carboxylic acid. Goes into the cell, and it uses that to make tight junctions. Actually, they make a lot of butyrate, and additional butyrate goes out of the cell, goes into the blood, it travels to your brain, and it stabilizes the blood-brain barrier. So butyrate is your friend. Fiber is your friend. Eating fiber makes you smarter because you're smarter when your blood-brain barrier is functioning well. Okay? Now, look at all these things. I don't know, about 25 things that all cause leaky gut. Most common one is a lack of dietary fiber, but there's a lot of other things. Fluoride can cause leaky gut. Excessive chlorine can contribute to it. Antibiotics, non-organic corn, this BT corn stuff. These things in processed food like carrageenan, dietary oils, excessive fat. When I say oils, I usually mean like omega-6 fats. Excessive dairy. Okay, some meds, non-steroidal anti-inflammatories, NSAIDs, aspirin. Okay, so there's a whole bunch of things. Artificial sweeteners. Some people even claim excessive simple sugars can contribute to leaky gut. I'm not so sure yet if that's true, but I have heard people say it, pretty smart people saying that. Okay, titanium dioxide, like I was talking about earlier. And also, if you got poor dentition, you can get bacteria from your mouth getting into your blood. And those are prothrombotic, like the bacterial endotoxins, LPS and LTA. But as far as autoimmune diseases, the reason why I'm showing the slide is big protein chunks can now get across. Normally, you can only absorb 1, 2, or 3 at the most. So tripeptide at the most. But with leaky gut, big chunks of protein can get across. And because it's animal protein, if you're eating meat, animal foods, those proteins can be similar in structure to the body's own protein. And the immune system can become a little confused. It'll bind to it. It'll form an antibody to it. But because they're similar enough to the body's own protein, those antibodies will sometimes cross-react with your own tissues. And that's thought to be one of the major, if not probably the main mechanism of leaky gut is related to this molecular mimicry. Similar protein structure is what mimicry means. Molecular mimicry with autoantibody cross-reactivity. Auto means to attack oneself. So your antibody is attacking yourself. Okay. So here is Royce Wang, MD, PhD from Harvard, the guy who has the best results of anybody in the world for the treatment of multiple sclerosis. He's got published papers out to 30 years. He's got additional claims of following people for 50 years. He says if he gets to them early, 95% of MS never progresses. And the most important thing, in his opinion, was to minimize intake of saturated fat, which would mean animal foods. Okay, here he is with Dr. McDougall. Dr. McDougall carried on some of his research. And here's Dr. Royce Wang's book. And they also, Dr. McDougall has at his website that video about blood sludge. I'll actually show you a slide of that in a moment. Here's just one paper, the typical type of paper you see on MS. Antibody cross-reactivity between casein, that's the milk protein, and myelin-associated glycoprotein results in central nervous system demyelination. And this is what I meant by Dawson's finger. See how this white line is perpendicular to the lateral ventricle? So right in here is cerebral spinal fluid. These are the lateral ventricles of the brain. All this white stuff is abnormal signal, okay? And this is a flare sequence, meaning it's really like a T2 weighted brain MRI axial image, transverse section through the brain. T2 weighting means that fluid is bright. But then you'll say to yourself, well, how come the CSF's not bright? How come the cerebral spinal fluid in the arachnoid space going into the sulci is not bright? That's because the CSF is suppressed. With a flare sequence, you get the benefit of T2 weighting, meaning fluid is bright, white on the scan, but you suppress the background signal of the normal cerebral spinal fluid. So it's a beautiful sequence. It's actually the best sequence there is for looking at the brain. The old saying is, if I was stranded on a desert island and I could only have one MRI sequence for looking at brains, I would want a flare. And I've seen many thousands of multiple sclerosis patients. And whenever I want to look at them, I'm always comparing the new scan with the old scan. And we call it the flare-to-flare compare. You pull up the axial flare images and you start counting the number of lesions, supratentorial, infratentorial. Okay. All right. So anyways, that's a Dawson's finger. All right. That's the classic appearance of multiple sclerosis. There's additional periventricular, juxtaventricular lesions here, but the Dawson's finger perivenous lesion is the most characteristic thing. Okay, so I'm telling you, there's a lot of these papers about autoantibody cross-reactivity, multiple sclerosis, and I do think that's the main mechanism. Okay, look what this guy says. We believe that cow's milk aggravates the disease, okay? And it might benefit restricting, dairy products. Well, duh. I can tell you, I talked to neurologists. Most neurologists don't know this. People in the nutrition community have heard Dr. McDougall and Roy Swank talking about MS and dairy and sat fat for decades. But this is not known in conventional medicine for the most part. I recently saw a bunch of MS lectures from a very famous hospital. None of the neurologists are aware of this. I'm telling you, they don't know anything about nutrition. It's frightening because nutrition is the most important thing to know for health, and they don't know it. Okay, and toxicology would be the next in line subject. They don't know that either. All right, so here's the video made by Roy Swank. Dr. McDougall's got it on his YouTube channel, Blood Sludge, blood flow before and after eating a high-fat meal. Basically, the red blood cells have a negative charge, a zeta potential on their outer surface, and a molecule that's big enough and positively charged can stick those red cells together, clump them together. So the blood, instead of being like water, becomes like a milkshake, becomes thick. The reason you have blood pressure is to pump blood to the top of your brain, your cerebral cortex. You have to pump that blood against gravity. So if you're pumping thick blood, then your blood pressure is going to go up when you got the chylomicrons. That's your initial phase of fat absorption. But also LDL cholesterol does it. Triglycerides will do it. Stick the red cells together. When the blood pressure goes up, it starts to injure the arterial walls, and that causes atherosclerotic plaque. It also is thought by Roy Swank to damage the blood-brain barrier, and he believes that's the mechanism allowing autoantibodies to get across the blood-brain barrier is injury due to the hypoxia and flow-related components of this high-fat meal. And why do I think he might be right? I'm not going to show it in this talk. I don't have enough time, but I've given other lectures where I talk about blood flow consequences of a high-fat meal. One of the things that happens is they think it's a saturated fat, but you get activation of the red blood cells. Activation of the neutrophils. The neutrophils are the most common white blood cell in the blood, about 65% of white blood cells, to release their granules of myeloperoxidase, MPO. And the MPO is very cationic, very positively charged. It drops onto the arterial lining cells, the endothelial cells. It interacts with the endothelial glycocalyx. That's the covering they have on the arterial lining cells. And they are very negatively charged. They have a zeta potential. Everything normally has a zeta potential, so they don't stick together. You don't want clots to happen for no reason. But they will collapse collapse down the glycocalyx. When the glycocalyx collapses down, beneath it you have adhesion molecules like VCAM, vascular cell adhesion molecule. The white cells will bind to those, and they'll start to travel. They'll start to open up the tight junctions between endothelial cells, and then by diapedesis, enter across the endothelial cell. So why am I going through all that? What I'm trying to tell you is there is a clear, plausible, known mechanism whereby a high-fat meal will cause leakiness of the blood-brain barrier. And that's a mechanism whereby these antibodies and immune cells can get into the brain and cause brain damage. Okay, so there's a very plausible, well-known mechanism why I think Swank and McDougall are right. All right, here's a paper by Roy Swank. Okay, he says intravascular aggregation associated with alimentary lipemia. The fat causes injury to the blood-brain barrier is what he suspected was happening. And these are chylomicrons associated with, blood sludge. Here's a lady by the name of Sara Stanchik, and she had multiple sclerosis, pretty bad. She's like, I think she was in a wheelchair, and then she got better when she became a low-fat vegan. And she wrote What's Missing from Medicine. She, I think, made a documentary movie as well. So basically, she, went vegan and she got better. What I thought was funny was she said that when you're a doctor, you finish med school, then you got to do residency. Residency is anywhere from 3 to 7 years, depending on what you go into. She says residency teaches you to be unhealthy. You take lots of night calls, so you're sleep deprived, you're stressed out, and then you're in a hurry all the time. You're hungry, so you start eating junk food from the vending machines. The drug reps often sponsor lunch, and you eat the crappy fast food from the drug reps, crappy cafeteria food. You don't exercise anymore, and all that stuff makes you sick. It's kind of funny, and many doctors carry those habits. They almost all of them drink coffee. It's like considered cool to walk around drinking coffee as a resident. I can assure you, when you see the team making rounds, it's very normal that they're carrying cups of coffee. Okay, here's a paper. Head trauma results in many-fold increased risk of multiple sclerosis. So the point I'm showing you that is that it's multifactorial pathways of brain damage that contribute to increased risk of multiple sclerosis. Okay, not that many women get traumatic brain injury. They could if they play that field hockey stuff. Okay, aluminum in brain tissue. Maybe if they're diving, college diving, I think is stupid. You know, head trauma when you hit the water. Aluminum in brain tissue. Okay, so this paper just showed at autopsy they had a lot more MS. The aluminum content of brain tissue in multiple sclerosis was universally high, with many tissues bearing concentrations in excess of 10 ppm, some exceeding 50 ppm. Okay. All right. Aluminum causes leaky gut. Yeah, that's another mechanism for it to contribute to autoimmune disease. That's bad. Aluminum-induced intestinal dysfunction. It really damages the gut lining. And that's in your tap water. That's intentionally put in your tap water as a so-called clarifying agent. Well, you know what? I think it's clear that it's not worth that risk, but nobody listens to me. All right. Now, here's more papers. Aluminum in human brain from donors and multiple sclerosis, okay? We have confirmed that aluminum content of brain tissue in Alzheimer's disease and multiple sclerosis is significantly elevated. Okay. Also, aluminum is elevated in the brains of so-called Alzheimer's disease. It's a major, major neurotoxin, and so is mercury. It's also, unfortunately, sprayed in the sky. Not a good thing. Okay, here's just another paper on mechanisms of MS. We're not going to get into all that. Here's an interesting paper. In South Africa, this paper is written in 1979. The first colored South African person to have multiple sclerosis confirmed by autopsy. 1979. Why not sooner? Maybe they weren't putting in mercury amalgams. Maybe they were still eating plant-based diets. You get it? Okay, here's showing the worldwide incidence of multiple sclerosis. A lot more common in the cold countries like USA, northern USA, not as much in the South where it's warmer. In the South, people eat more plant foods. They exercise more. They get more sunlight, good for the mitochondria. Okay? Because you see, it's really concentrated in the places where they eat a lot of meat and they don't get as much sunshine and they don't eat as much plants. All right, so now there's all this detailed stuff about MS. I don't think we're going to go into all this stuff because I think you got the point about it. That was the most important thing. And like I said, when you see a sick patient, the first thing you want to fix, just a random typical chronic disease patient, would be get the diet correctly. I say that's the number one thing to fix. Low fat, low sodium vegan with no oil, no processed food, whole foods only, 100% vegan, intact foods, single ingredient foods only. That'd be step number one. Step number two would be filter your water. You know, whole house carbon filter, get a reverse osmosis for your kitchen. Step number three would be, you know, manage your stress better, have a clear-cut purpose in life. Religious people are healthier. Make sure you're getting your sleep as best you can. Usually that means going to bed earlier, avoiding the bright lights at night, like the blue LED lights. Your body perceives blue as daytime, and most lights nowadays are blue LEDs, so you want to minimize those. Put lower wattage bulbs, use less bulbs, figure out what it takes to avoid blue light at night to get your circadian rhythms better. Next thing is most people are drinking coffee or tea or some other form of caffeine. You want to stop doing that. Then get rid of the estrogens. Okay, people that's in the tap water, we already talked about how to filter those out. Minimize personal care products for all the estrogenic exposures they cause. Then check if you're on any medications or supplements that are inhibiting your mitochondria. And that'll potentially help you feel a lot healthier. Make sure you don't experience any other drug side effects. And then once you've done that, you're still not better. Start looking at the teeth. So the bottom line, if you haven't got better enough from all this other stuff, the other elephant in the room is all this dental stuff. The fluoride, the mercury, the root canals, cavitations, and some of the other metals can be toxic too. Other sources of mercury besides the dental amalgams, root canals, they often put mercury in them. Fish is a common cause. This one lady, Jane Hightower, she wrote a book about it, and she said all these yuppies were getting demented. And people couldn't figure it out because they would test their blood and their urine, and there wasn't really that much mercury there. But the problem is you got to test their hair. When they did a hair testing, they would find they had more mercury exposure. She just told them, stop eating fish. So I thought that was a little bit funny. All these yuppies think they're so healthy and with it, and they're eating more fish. Fish is stupid. Fish is just marketed. I would never eat fish, by the way. I think it's totally toxic. It's very high in saturated fat. The ocean's like a sewer, unfortunately. It's polluted with tons of stuff, tons of mercury. And like salmon's 50% fat, 50% protein. There's no carbohydrate in animal foods other than like milk. So it's a total loser, 50-50 protein and fat. I mean, how are you going to get your 80-10-10 and better with that? Forget it. coal burning electrical plants, mining, a lot of these weird lotions. A lot of people like rubbing stuff on themselves, like women especially. This is a lotion for moisturizer. This is a lotion for skin wrinkles and all this other stuff. Forget it. I hate putting anything on me. I'm like the dog. I don't want to smell anything weird, and I don't want to put anything on my body. Okay. Some fungicides will contain methyl mercury. That's toxic. Some psoriasis medicines, acne medicines can contain it. Tattooings can contain it. Be real careful about getting tattoos. I think tattoos, not a good idea. I mean, if you're in a unit as part of a group moving out, I could get that, but I don't know. I don't find it attractive when a woman's got tattoos. Air conditioner filters, some of them have that. I don't know how common that is. I doubt it's that common, but I would definitely not want it. Okay, enough about all that. Let's see what else in these charts. This is when I went through that book line by line because I wanted to really understand it. But some of this I think is too detailed for our purposes. You got the main points. Be careful about taking out an amalgam and putting in a new metal, because if you have two different types of metal in the mouth, the two different types of metal will have a different electrical potential and cause increased electrical current conducted through the saliva, and that can increase mercury vapor escape from the amalgams. This guy wrote a real good book too, Gamal's book. It's real detailed though. It's like 450 pages, but it's very good. This is a really smart dentist from Australia, but it's kind of like a pretty advanced book. He's got a really good website too. His website, I think it's called realdentalinfo.com. Here is an example of amalgam removal. It's a big deal. They know it's toxic, okay? Look how they deal with this stuff. It's so toxic that they feel they have to wear a gas mask to be around it. But meanwhile, they put it into people's mouth. How insane is that, okay? This is a vacuum suction hood over the person's mouth. They've got an oxygen tube going straight into the nose so they don't breathe the air in case they have to drill into it, okay? And here's more dentists working, on removing the amalgams. Like I can see, it's a pretty involved procedure. They put coverings over the patient because it can even get into you going through your skin. Okay, it's toxic stuff. So anyways, that's all I got. I hope you found that helpful.
Thank you. Thank you again to Dr. Peter Rogers for connecting the dots most people never see between what's in your mouth and what's going on in your nervous system. If you learned something new today, hit that like button, subscribe, share the video with someone who's struggling with MS or another chronic illness. Peter also has a new book that covers all of this. It's called Prevent and Reverse Dental Diseases. Peter, let's see it there. I'm getting my copy. Get yours. I'm going to put a link to it down below in the description. In our next and final episode, Peter is taking on dentistry's biggest sacred cow, the root canal, and asking if it's really helping people or just another trap. So stay tuned. Thanks again. Thank you, Peter. We'll see you on the next one.